Justin and I wanted to make a video to update friends and family that don't know kind of what's going on in our pregnancy thus far. We thought it'd also be a good idea for us to be able to look back on memory-wise and all that we've been through. And, you know, we're also hoping that this video will maybe help others that might be going through something similar, and maybe help us as well.
Yeah.
People who have maybe done this before are also going through the same thing, just to have more people to lean on and talk to you about it. Anyway, so I'm currently 30 weeks pregnant. This is our 4th baby. I'm due August 4th, and everything went great the first half of my pregnancy, very normal pregnancy. And then we got to our 20-week ultrasound, and that is kind of where our story begins. Yeah, okay. So, so we had our 20-week ultrasound in March. I forgot already what date it was.
Like the 16th.
March 16th. Just a normal, you know, the anatomy scan. We're not finding out the gender of the baby. We're keeping it a surprise. And the next day, we went to I went. Did you go there? No, you weren't there.
No.
No, I was there. The next day I went to my OB appointment, and she kind of let me know, just kind of going over my ultrasound. I was fully expecting it to be, everything's fine, it's all good, baby's healthy and perfect, just like my last 3 pregnancies. However, she did say that the tech questioned that the baby had a club foot, and I never heard that term before. It sounded scary at the time. After looking it up, it's really just when the foot turns inward and the baby will need, you know, possible casting or something. So, but she said the tech just questioned it, and that we should see fetal medicine doctor and have another ultrasound to kind of check it out further. So we waited about a month to get in with fetal medicine, and that was April.
Yeah, April 14th.
April 14th?
Yep.
April 14th. So we had that ultrasound. It was pretty much like the first one, you know, a long ultrasound. They look at everything. And then afterward, though, we get to meet with the fetal medicine. That dryer is really loud. That's our washing machine. The nice thing about the fetal medicine ultrasound is you get to meet the doctor right after and go over the results. So we did that. We had the ultrasound. We went in the room next door. That is so loud. Should I stop it? Okay, so we met with the doctor right after, and this is what she had to say. Go for it.
Oh, so the specialist confirmed basically that the baby did indeed have a club foot.
The left foot.
The left foot, so single club foot. And also too, she noted that she saw what is called a choreplexus cyst. I believe that is the correct term. And to our knowledge, we do believe that is basically a bubble of fluid that gets trapped in the brain. And she said that she wasn't too concerned about it. Reason being is generally they dissipate before birth and they do go away. So she didn't really make it a big deal, but obviously, you know.
That's kind of a big word. So for
it's
us, I was like, what is that?
Cyst is a big
Never
word, and
heard of that.
yeah, so obviously we were just obviously concerned, even if she told us it wasn't a big deal. We just don't want to hear anything wrong with the baby either.
Right.
So she did tell us those 2 items, and then, you know, obviously with other questions, you're kind of just like, well, do we see anything else? I mean, is there anything else that might be wrong? She said that when they were taking images of the heart, she didn't really get any good pictures. Reason being is the baby's been extremely active this entire pregnancy, and the baby was extremely active during that ultrasound. And she said the pictures just weren't great. She said the one picture that she happened to see, maybe one or two, she noticed something looked a little bit off in the heart.
But she wasn't very concerned.
Yeah, she wasn't very concerned, and she didn't make it really a big deal. Basically, we'll just monitor it, on the next ultrasound, and just make sure everything is okay.
Yeah.
This specialist did come from Freighter, Milwaukee, and I happened to ask a few questions because I'm currently a patient there as well, and she happened to ask why why am I a patient? And I just explained that I actually have a congenital heart defect that I was born with, and I've had 2 open heart surgeries, and then she kind of seemed a little bit like, oh my gosh, maybe that's why I saw something in the ultrasound. So with that being said, she recommended that we see a specialist sooner rather than just wait for another normal ultrasound. She recommended that we actually go down to Children's Hospital,
do an echo,
and do an echocardiogram down there.
Just to get them. They do really good imaging of the heart. That's like what they're specialized in.
And she said this is more so just peace of mind. One, obviously with me having a congenital heart defect, and just making sure, just with that being said, like, make sure everything is okay. So yeah,
the end of the appointment.
Yep, she recommended.
Yeah, she recommended because the baby has 2 defects, the clubfoot and the cyst in the brain, to get genetic screening, which is just a blood test.
Yep.
And so after that appointment, we went straight downstairs to the lab, got my blood drawn, sent that in. She told us it would take about 7 to 10 days or something to get that back, and they test for the top 5
genetic disorders.
I don't know, a few trisomies and
trisomy 21, 13, and 18, and then a few other. Some
I
other
don't know what
less common ones.
Yes. So anyway, that was pretty intense to hear, and we've never done genetic screening with our other children, so that was kind of a lot. Anyway, so then we left that appointment, we left the lab, and then she ended up calling us in the car.
Leaving the parking lot.
We were a little shook up, about the heart, not knowing 100% if it was okay, and hearing all this big news. But she said, I looked over the imaging again, and it doesn't seem like it's probably not that big of a deal. I don't think you have too much to be concerned about. I really think it's just because Erika's very thin, and maybe I just saw something. I'd still like you to go to get your echo done at Children's, but just, don't put too much thought in this. Don't be too worried. It's not a huge concern in her eyes. So
made us feel a little bit better. Obviously, leaving that big appointment and hearing everything. So we went about a week. Erika did happen to have just a normal OB appointment the following Thursday. Throughout that entire week, obviously, anxiety based upon the test results, and wondering when they're going to come in and what's going to happen. So Erika went and we had the normal OB appointment. Just the familiar questions, and then we obviously just asked if they happened to
get our results,
or if they heard of when they were coming in. She told us she would check on them and give us a call just to let us know when we can expect a ETA.
That is the only thing we could think about for a week straight.
That's the only questions that were on.
Does our child have a genetic disorder? I literally couldn't think about anything else. It was huge. On my mind, that was a tough week. Just a lot of, is this happening? Is this not happening? Is baby okay? It was just,
our first 3 children have, like Erika said, have never dealt with any of this.
We've never had any hiccups in the ultrasound.
So this is all very new to us. So like we said, our OB said she was going to give us a call on a timeline. The next day, Friday, she ended up calling Erika while I was working. And
what did she say?
She asked,
she's like, do you have time to talk? And I thought it was about my glucose test, because I also had my glucose test in between there. So I was like, oh, she's probably going to tell me my results now.
But
then she said, is Justin
available
to talk to? And I'm like,
That's when your heart kind of sank, and
It did.
you said,
And I remember I'm like, all right, I'll go up there. So I went upstairs with Justin. He was working in his office. Yeah.
And we put the phone down, and
Put on
we're like, all
speaker.
right, we're both here.
Yeah.
And she let us know that our baby tested positive for trisomy 21 Down syndrome. And yeah, obviously, just like this, that's probably a little, it was a lot harder and more amped up than this, but it was just.
Well, we've known this for a month now.
Yeah.
We've been sitting with it now, but it's kind of like when you talk about it, you're like reliving it.
And it just felt like everything went completely numb, cloudy, like there wasn't.
No, it felt like it wasn't really.
It wasn't happening.
It was
like just like almost like in a dizzy dream. I don't even know how to explain it.
Yeah.
They obviously they asked us, if we had any questions, and we couldn't even come up with anything.
No.
We just sat there almost blank, and we got off the phone, right? Obviously.
She said, well, she just we kind of ended the conversation with her like, well, you have your echo coming up, so I'll make sure that you meet with a genetics counselor after your echo that day. At Children's, just so we can get some more information. They can go over our test results and how we got that result. That's kind of how we ended with her.
Yeah, and then we did say at the very end, we asked about the glucose, actually.
I'm like...
And Erika's like, well, did my glucose test at least come back? Did I at least pass that? And she's like, unfortunately, no, that did not pass either. I was going to save that, but since you guys asked, Erika did not pass the glucose test either.
Yeah, so then she scheduled me to do the 3-hour glucose test. So that was just another added thing. Not that it's a big deal.
Yeah,
the baby,
but just,
obviously. It was just kind of a lot of news to hear that day. And then...
the following week.
Was it a week?
Yeah.
It was. So we sat with that news for a week.
Trying to digest it. And not look anything up either.
No, we didn't. We don't Google anything. Yeah. We don't want to. We don't want to scare ourselves with what is to come or not to come, because technically the test results are not diagnostic.
Yeah.
It's, she said if I wanted a for sure answer, we would have to do the amniocentesis, which I'm not comfortable doing because it can, there's risks involved, water breaking, miscarriage, or possibly hurting the baby. So not willing to take that risk. Yeah. But she said it's like she said it was like a pretty high chance that, our baby.
Especially with all the other markers and stuff that came up in the ultrasound. That's what she informed us, made the probability quite high.
Right.
So we went the week, and like we said, just trying to find some type of acceptance, and obviously, no matter what, we're having the baby, and we're gonna love the baby, but just trying to deal with all that news was a lot. So the following week, we had the heart appointment for the echocardiogram down at Children's. Yeah. We went down there. We did bring the kids, didn't we? Yeah, we brought the younger two.
The younger two.
So we went down there, and obviously the entire time, everything about Down syndrome was on our mind, and we just kept telling ourselves, like, let's just make it past this echocardiogram.
Let's clear the heart.
Clear the heart. We'll be fine.
And then we just,
we'll deal with
this as it comes, and that's.
And we felt good, obviously, going into the heart appointment just because of the news she gave us after.
Yeah, the specialist.
Just saying not to worry about anything. So we went into it, and everyone was, very kind. They told us they do, the tech would do 15 minutes worth of pictures, and then the doctor would come in and do 15 minutes worth of pictures, and then they would just go over the results with us.
Yes.
So they did just that, and
they were not talking during.
Yeah, there wasn't a lot of talking. No. Eric and I didn't do a lot of talking. I think maybe nerves. The
doctor took quite a long time
Yeah.
of pictures, more than I expected. He was just really
Yeah, and you know, when they're doing it, you're trying not to look into how they're doing things too much, and you know, you can kind of see them hovering over certain spots a little bit more than some others, and you're just like clicking away at the pictures, and you're like, oh, please don't, you know,
right.
like,
You don't want to read into it.
Yeah, you don't want to read into it too much.
I think we started.
We
started
started
to get a little
feeling-
nervous because he just took so long.
Yeah.
Yeah.
And he did point something out to the tech too.
Yeah, he pointed
you know,
at the screen.
Just pointed at the screen, and you know.
No words, just a point.
Yeah, but obviously to us that meant the world. You know, like that something was happening. So we got done with the pictures, and he told us we'll go over the results in the next room.
We'll kind of go over what it looks like.
And what to expect for the birth. And
Post-birth, and instantly that's...
They left the room, and Eric and I just sat in there, and we looked at each other.
Like, oh boy.
And we're like, this doesn't feel good. So we went into that room, and he told us that the baby had a congenital heart defect. The baby has what's called VSD, which is a ventricular septal defect, which is a hole in the wall between the ventricles. It's not what I have.
No.
This is a much more common defect.
Yes, which is a blessing.
A blessing.
It's common, and I mean, out of all the heart defects, it's a very common heart defect. They see it a lot.
Yep.
They've dealt with it a lot. Justin's heart defect is very rare. That's why it's still not fixed.
Yeah.
But this one's a more common one, I guess.
So
he told us that the whole, because we're like, you know, can't these like close up on their own?
Yeah, he told us that, you know, generally these types of defects can sometimes close before birth. And then we don't have to do any type of operation, because he did tell us that with the defect, the baby would probably will need open heart surgery between 2 and 6 months of age. And
based on the size,
he said I don't see the hole closing up, because
it's a moderate to large size hole, and he didn't seem very optimistic that it would close up on its own, or he said that possibly the tissue could grow over it a little bit and make the hole smaller, but he just didn't seem. He said it didn't seem very likely, so we need to expect open heart surgery anywhere from 2 to 6 months of age. So.
And then obviously he talked about the birth plan.
Because of that.
Because of because of the Down syndrome, VSD is actually a very common heart defect for kids with Down syndrome as well.
So that was just another
added trait
marker
to our results.
That it's pointing more and more towards Down syndrome.
So we talked about the process as far as delivering the at Freighter.
Well, they recommended that I deliver at Freighter and be induced, just because they said sometimes children with Down syndrome need a little more help after birth, sometimes with like respiratory, and our hospital doesn't have a NICU, so we need to be somewhere in case our child needs that. So that obviously kind of threw me through a loop too, just knowing that everything is changing, and you know, the baby needs help and needs a surgery, and it's just a lot to go through.
So we ended up ending that visit with him, and we stayed in actually the same room, and they scheduled a genetic counselor to see us as well that day, basically to go over our results from the genetic screening, what it all meant, how they get them. Not as much of a what to expect, but they've dealt with this, you know, thousands of times. So, you know, if we had any questions regarding, you know, the genetic disorder, you know, we could ask those things too. Obviously,
we didn't really have any questions.
No,
I
we're
was
still
too
pretty
wrapped
blank,
up in
with the heart.
So I couldn't think of any questions, even though I probably had a lot. I just couldn't think at the time.
Yeah.
I don't know. She brought up the same thing, that it's a high probability, and we should just prepare for Down syndrome, and
because as parents with, you know, 3 healthy children, very healthy. You see them grow, and that's all we know. So, and obviously, no matter what, we're going to love the child, but we're just used to,
it's just scary.
It's just scary for
the
unknown.
unknown, and just how, just how different it'll be for the baby, and how they'll grow up differently. And
yeah. So yeah, and then you kind of just ask, because these are just common questions, how you're trying to find some sliver of hope, like maybe the screening's wrong,
Right.
But they kept telling us, like,
with the heart
they said they don't think
defect
it's a bad thing to hold on to hope, I think more so from a mental standpoint, for us, but they said I think we really need to
just prepare
for this.
Yeah.
Yeah, so
it's been really hard.
Yeah.
It's been a lot of, is this happening? Is this not happening? Anger.
Yeah.
Acceptance. Back to not accepting again. It's just been like a lot.
Yeah. And there's been even more roller coaster emotions. One, because, you have those appointments, and then you start to do a little bit of research regarding the screenings and stuff like that, and
how people have gotten
false positives
before,
and we actually even asked them if that's a possibility, and unfortunately she told us in her time she's never seen a false positive.
Right.
So that was obviously disheartening to hear. And then looking after that appointment, that was how long ago was that? So
that was like end of April.
Yeah. So it's been a while. We've met with an orthopedic surgeon for the club foot.
What that'll look like
post-birth, which will be casting, and then boots and braces.
Casting for 6 to 8 weeks, and then boots and braces for 4 to 5 years.
After the surgery, yeah.
Yeah. Obviously, you said, you figure out the heart and what needs to happen there first, and once the baby's ready to.
Yeah. And then talking with the orthopedic surgeon, we talked about a club foot being a trait of Down syndrome and stuff like that. And
that's what we were told.
That's what we were told. And then, he's telling us that he doesn't believe that would be a trait of Down syndrome, which even threw us even more for a.
He said he's like, I would spin that the other way and say that the club foot would kind of be less of a chance for Down syndrome.
Because it's a tight ligament, and generally children with Down syndrome have loose ligaments and limb,
Yeah, their muscle tone
more flex.
Yeah, isn't as good.
So, obviously getting off that remote appointment, we're like, what is our test correct, and everything else. So we ended up, we actually had another appointment with Fetal Concerns in Fond du Lac.
Oh, yes.
So we met with the same specialist that we did with the club foot. Yeah, another ultrasound.
Yeah.
And at this point, that actual specialist that we met with the first time that addressed the club foot and the cyst, this is our first time talking to her after finding out about Down syndrome, after finding out about the heart defect. So when she kind of saw us that next time, she was kind of blown away with the results that we had, and I think she felt really bad because
she made us feel like
we were going to be fine.
Yeah.
Not that we're not fine, but like that the baby was going to be
more
perfectly healthy.
More healthy than
what she thought. Yeah. So I forget the point I was going to try to make. So we went over everything with her, and we we're trying to ask her about some, the genetic screening, and just kind of address some more questions that we had, obviously with having all this time to think of things. We always kind of like had questions in our mind going into appointments now, trying to figure things out. And we asked her if she's ever seen
people get false
positives. And she said, yeah, she has seen them. So we're like,
what? Like, why do people do this screening? It kind of, I feel like I shouldn't have ever taken the screening, because regardless of the results, we're having this baby, and it's just been more taxing on us,
Yeah.
not knowing if this is happening or not happening, and kind of hearing different things.
Yeah.
You know, prepare for it, but also sometimes it's wrong. So that's kind of been a lot.
So that's kind of where we are.
At that ultrasound, she did say that the plexus cyst did dissolve.
It did dissolve, yeah.
So that's a positive. So that's great.
Yeah, we're very happy about that. Erika's glucose test did come back. She was fine.
Yeah.
So the 3-hour test,
Yeah.
she
I don't have gestational diabetes.
Yeah,
So that's good.
so that was good.
Yeah, and then I think going forward here, we have another echo at Children's. We have another just an ultrasound to kind of look over the baby again at Children's. We meet with some midwives at Fredert to kind of look into delivery there. And I think that's kind of it.
Yeah.
Going forward, we'll have a few more checkups, just to kind of monitor the baby and hopefully, I mean, the biggest thing for me right now is just that our next echo. I just really hope that hole has gotten smaller.
Yeah.
So
hoping for that, praying for that, and then I guess just to kind of what we know at this point, definitively, is the baby does have a heart defect with VSD. The baby does have a single club foot on the left foot. They did say it was minor, so that they did note that.
Yeah.
But still needs all the surgeries and stuff, or the surgery.
One
and the casting,
surgery and the casting.
and the casting and braces. And then we have a very, very, high chance of Down syndrome.
Yeah. I guess we just wanted to, put it out there, and I don't want anyone who does have a child with Down syndrome to feel like, like, I don't want this to hurt anyone's feelings, because I think right now we're just in a state of like, we're hopeful. I don't know how to describe how I'm feeling.
Yeah, it's
still a scary feeling because it's just an unknown.
Yeah, and we've went through like this, like we said earlier, like this roller coaster of emotions where you hear like, hey, there's no false positives, your child, tested extremely high for Down syndrome. And like I told one of the genetic counselors that we met with, also remotely, I said that was the time in the pregnancy. As a father, you're not as attached, obviously. You don't have the baby inside you. You're not feeling the kicks constantly. You're not able to talk to the baby all the time. That was, and especially not knowing the gender. I said that was like the first time finding out that the baby had Down syndrome that I felt connected to the child, because I felt like the child had an identity, and I felt like I, really started to love the baby. And not that I didn't love the baby before, but
feel connected.
Yes, because I put myself through that emotional strain of trying to find acceptance in it, and being like, okay, I can see Erika, myself and Erika as having a child with Down syndrome, and we're gonna, flourish in life, and we're gonna make the most of it. And you pour your heart into it, and then you start to get mixed emotions, like, oh, if the child, there's false positives out there, and then you're just like, wait, what? I just poured myself into the idea of having a child with Down syndrome, and
kind
it's
of
like what you're telling me now, it
our
doesn't.
family and what that baby is.
It's been
a lot. It's been a lot.
But yeah, we wanted to make this video, like Erika said, for anyone
who's gone through this before, who's maybe currently going through it, or we know that everything is gonna work out, and we're excited to have this baby. We love this baby. I'm so excited to meet him or her, and we just wanted to kind of let everybody know what's been going on. And
I mean, I guess if anyone ever wanted to reach out to us as well, more than able to, with any questions or anything, but honestly, support
stories that you've gone through, or So I don't know. I think that's kind of it.
Yeah.
Yeah. Love you. Is that good?
That's good.
Okay. You're gonna shut it off.